Hey there, this is Jenny Chen. I'm the founder of 3D Heals. Welcome to the Lattice podcast, the official podcast for 3D Heals. This is where you will find fun but in-depth conversations with technological game changers, creative minds, entrepreneurs, rule breakers, and more, focusing on how we can use 3D technologies like 3D printing and bioprinting to reinvent healthcare and even life sciences. This podcast will also include AMA or Ask Me Anything sessions, past Instagram live interviews with influencers, and other direct engagements with our tribe. So, here we go.
Hello.
There's always technical difficulty. That's the rule of the game. Every single one have problems, but we always make it. So I'm really glad that you can join us today, Mayra.
Thank you.
Really short introduction, and I'll let you to talk to the audience to tell them what you do. But I met you almost 4 years ago, or is it 3 years ago?
3 years. I think it's 3 years ago.
Yeah, no, I think you're one of those people who I would say Columbus of our age who travels all over the world to preach how 3D printing can revolutionize dentistry and even healthcare. Mayra is also the founder of a new startup focusing on dental 3D printing education called Innov 3D, which is where we're broadcasting this from. And also you're practicing dentistry still, right? You're still practicing dentist, and you're also the community managers for many different organizations that include 3D Heals and also Women in 3D. And you're very active in the community. So I think here today, I think we want to make it fun to people who are joining us, and also everybody, you can feel free to type in your questions for Mayra. So anytime there's a question, I will stop and address them, or whenever the flow goes. So Mayra, why don't you tell us your journey as a 3D printing dentist?
Yeah. Thank you for inviting me to be here today and all the other times we are together. It's always good to be here and with the community of 3D Heals. So I think I started this in 2015 when I was starting my Ph.D. here at the University of São Paulo. So I was trying to find something to help me to deliver best options for my patients, focusing on the splints, the dental, the night guards. So I was trying to find something different, and because of this, I discovered the 3D printing technology. And here in Brazil, we have almost nothing in healthcare area at this time because it was starting all around the world. And here, as we don't have the companies, the factories, we are most of the materials here, the equipment here, we are always importing this from other countries to Brazil. So it was difficult here to have this equipment and to understand how it works. And because of this, I was trying to go to the US and to know other people. And I started doing this. And because of this, I knew 3D Heals. And it was amazing to understand how the community can make things, the speed of the things going faster, and we can scale this much more with other people working together. So I started this mainly because of my PhD project, and after that I discovered all this world, and I started doing all those things and trying to bring other people to the community.
So we talked a little bit about this, of bringing a few potential cases that you have done. Do you have them, and do you want to show us what?
Yeah, I will show first all these things start because of this little piece here. This is a night guard that I was trying to make it to fit to the internal part, this part. I don't know if it's clear to see, but
Yeah.
this part that fits on the teeth, this is something that we are trying to make it better than now, the analogical form. So we now can do this, and you don't have to adjust this part. You just put on the teeth and they fit perfectly. But the difficult is when the teeth occludes and you have the balanced, all the teeth touching. So because of this, it's difficult when we are doing the other way, the old, as I was doing before, because you are always having to adjust. There is a lot of adjustment. And now when we design this in the computer, so we can program these and adjust these in computer and print and deliver to the patient with the adjustment. So this is the all those things started for me because of this. So nowadays in 2 hours I can deliver it for my patients, one of these already adjusted, so it is good, and the patients can the benefit is they don't have to wait.
Yeah.
Sometimes they are in pain, or they are there's discomfort because they don't the occlusion doesn't fit, and you can start the treatment in only 2 hours. So you scan the teeth and produce this in 2 hours. So it's really faster and better for them, the results.
Yeah. I
After
remember
that,
I remember when I have my own night guard, it takes a week to actually get my night guard back. That's the conventional way of making it. You have to put this gooey stuff in your mouth first because people don't use
yeah,
3D scanner. And then you go, that's one visit. That's already one visit. And then you have to go back to your doctor to get fitted for the night guard again a couple weeks later. And meanwhile, you have nothing.
yeah, you have nothing.
So yeah.
Yeah,
So how is this compare now? This night guard process comparing to like 2, 3 years earlier? Do you think this 3D printing process itself has also improved during
yeah,
this time?
yeah. When I started doing this, first thing, we have one or two companies that produce the resins that are biocompatible. So nowadays we have a lot of companies doing this, and you can use different kind of materials to print, and they are more reliable. They are more resistance. They have more resistance, and it is much better now to have this, to polish this, because when you finish the print, so when you finish the print, it is like this. So you have to remove the supports, and it's going to be like this. I don't know if it's
Yeah,
clear
I can
that
see it.
it
Yeah,
is not polished,
right.
and you have to polish like
I
this.
see. There's a difference.
So
Yeah,
nowadays it is easier to do this.
I see.
The even the software, the printer software, when you are deciding when you are going to put the supports, nowadays it's better. So you can try something different to use less support, and you have a better resolution, a better surface to polish,
Mm-hmm.
and the material is better. And considering the long-term use, they are better now than before. So this is the most different thing, considering the technology. So the scanner is really similar, the software too, but the printer and the specific the resin, they are getting improving every day. And I think this is for me, considering the healthcare products, I think now we are at the point that we need better materials for long-term use. So when I consider just the model at the teeth, and it is okay, it's good, but when we consider the materials that is going to be used, during the time. So we need some improvements.
Yeah. So obviously, 3D printing is a technology that we're both very excited about. My question, and perhaps a little bit difficult, several difficult questions are, one, how is this perceived by patient? Does the patient love it, or are they just kind of okay?
Considering this, the night guard, they love it because most of them, they already have this experience of the conventional. They know how long it takes to be done and to be the adjustment, uh, during in the dental office, the patient, they have to wait a long time to close and check the contacts and to adjust again. So this is really better, and it's much more comfortable. So they go, because a lot of patients, they complain about the pressure in the teeth. So when the inside the splints, this part is always pressuring the teeth. So when you have a better fit, it is more comfortable. They can use better this. So they love this.
Mm-hmm.
There are a lot of different things. For example, the guides for surgery, the surgery guides.
Mm-hmm.
It is better for us than the patient. The patient, the benefit is for both, but they don't feel it. They don't see it because they don't know how is the difference.
Right.
So during the surgery is really faster when
Yeah.
you plan before the surgery. So it's really better for the healing, the healing process. But sometimes the patient doesn't understand that it could be different or it could be worse if we don't use this. But in this kind of device that they use, the device, the perception is better for them.
Mm-hmm. Yeah, no, I think there's definitely a lot of patient education as well for eventually the market to accept it. Um, the other question I have, a little bit hard question, is the economics behind these. Now, for example, producing this night guard, is this equal cost wise, or is it cheaper? What is comparable?
Um, it is hard to say this because it is really different in each country. Or, for example, here in Brazil, we have two options.
Mm-hmm.
Some doctors, they just scan and send to the lab, and the lab produce this, and it's going to be a little bit more expensive because the lab, they are going to think about their cost more, and plus the equipment. So they are going to have two costs because of this. When you have the printer in your office, you are going to spend, it's the same. So you have to invest in the equipment and the materials, but you don't have to pay for the laboratory work. So it is the same.
Mm-hmm.
But it's when you consider the dental office, the how much you are going to spend in two times with the patients. So it's going to be much more expensive than one time. So there are a lot of different things to think when you are considering the cost, when you are considering something like this. But most of the time, when you consider the equipment, how much you have to invest in the equipment, it's higher. But when you think how much time you save, the things are going to be similar, and you can produce more because it's faster.
Yeah, I mean, I did a financial model of 3D printing in hospitals. It's just a hypothetical economic spreadsheet of, if it makes money sense to have a 3D printing lab in the hospital. But for a dental practice perspective, maybe it is possible to argue that in the long run, when you have a in-house 3D printing center in the dentist office, you would have a long-term benefit or return of investment then on a short term, if you have increased patient volume, decreased turnaround time, and then decreased cost of the materials over time, and also more people in your lab knows how to do it for you instead of you doing every single case. Perhaps there is a way to really make that economic argument work.
Yeah, I think each day we are going, we introduce more different things that we can produce with 3D printer in dental office. So if you think to buy all this equipment just to produce the splints, it's going to be really expensive. But when you think that you can use this for a lot of different specialties in the industry, so it is going to be okay. It's going to be the same thing that we are already doing with the labs. And I think it's the thing now for me is to turn the materials more reliable than the conventional.
Yeah.
So at least the same thing. So I can tell my patients that it's going to last 6 months or 1 year, or how long it's going to last these materials. And nowadays it's difficult to say this because we don't have any study about this, and we don't have the experience too. So we are trying to understand how long it's going to last when the patient is using with the saliva and all this clenching.
Yeah.
And this is the difference, and something that we will have to be more secure to use even more in the dental office.
I think I saw a paper that you published, I don't know, a couple months ago. So I'm just curious, what are some of the ongoing clinical studies focusing on these dental 3D printing products?
So there are a lot of papers nowadays. People are just trying to understand better the technologies. And when I finished the PhD, I had a lot of data to understand what happened. And most of the problems were related to understand exactly what I was telling you, how materials are going to work, and how the post-processing, or even how can the process, the position in the 3D printer, if it's going to affect the results or not.
That's right.
Yeah. For example, during I did a clinical research during my PhD, and the patients used this kind of splint, and I don't understand why I was having different fits, the teeth, the internal adjustment. It was different from one patient to other patients. And because of this, I did, for the same patient, different positions of printing. So I used, during the print, I position it like this, or more horizontal like this, or like this vertical. And for the same patient, we did this with 10 patients, and we saw that there is difference because of how it connects with the platform and the touch, and all these there's an influence of this in the final result. And it is different when they are clear like this, and when they are solid, the solid color, they have different adjustments when we are using these two. Yeah. So these are kind of research we are trying to do now.
Yeah, I start to hear things about this, which is very interesting because I think every printer is different, the way every printer is constructed. So even with the same orientation, different printers may actually produce different results, which is worrisome because you would like to buy a printer to make the same products consistently for all the patients. So yeah, no, I think this is definitely a field that's worth more research and provide more guidance for the users in the future. Yeah. So I really appreciate your work on this.
Yeah, and it's important for people to understand exactly this, they have to know the printer they are using, and they have to know at least do something, some tests when they start using that printer, and understand how that printer is going to deliver the same result every time, and understand that if I'm doing this in this position and it's working, I probably I must continue using these, or if I'm going to use the other position, I will have to try a little bit, to test a little bit before delivering this.
Yeah.
Or because sometimes when you have that space, the platform to print, sometimes you choose just because we need space. So I want to produce more in the same space. So some of them I will put vertical, or other I'm going to use horizontal, and it's not going to have the same results. So it's important for people to understand this, because they can deliver it better, they can correct this, and they can know what can expect this. And other thing is about the post-processing. Oh, sorry. The post-processing, the method is really, really important. One of the research we did is because when you finish this, it seems like it is ready, and because it's hard and it has the final shape, so I think it's ready. And if you are a little bit busy or you are late, sometimes you think, why I'm going to deliver like this and I will not post-processing, for example. And in this resin, we half of when you don't have the post-processing. So this is when you finish this with the UV light, you are going to have double the resistance if you don't do it. So it is important people understand about the post-processing in healthcare, because the resin, they are considered biocompatible when you do all the process with the printer, washing, and the polymerization after all this. And if you don't do this, you are going to have problems with your patient, and you don't know exactly how it's going to work, the biocompatibility.
Absolutely. I mean, this is not a simple topic. This is your PhD thesis and your work around it the last 5 years or more. So, but you are actively working on educating the community. So you want to talk a little bit about your work with Innov3D?
Yeah, what I'm doing now with Innov3D, one of the difficulties I'm having here is to make the dentists, they are already working in their office and they are trying to go through these new technologies, but they are a little bit more resistant. And what I see is that the new generation, they are going and they are more enthusiastic about the technology. So what we are doing is to consider how to teach these new dentists, the students, so they can finish the university and be ready to the new market, the new dental market, and they don't have to learn the old things to learn after that the new things. So because of this, what I'm doing with Innov3D is I'm trying to help the teachers at the university to understand better about the technology and insert these in their classes. So can they will have contact with this during all the years when they are studying dentistry, and not only when they are going to be specialists. So they can finish the dental school and they know about technology, how the scans, how works, and the printers, and how can they can develop something new or new technique. And this is something that I like most about 3D printing. You can reproduce something that already exists, but you can create something new that never existed before. And I think the new generation, they are going to understand this better and faster. And because of this, I think we have to help them to understand about this and to learn about this.
Okay, so we have an audience question from Noon's Fair. He's pretty active, or she is pretty active. The question is, what are the differences in adoption of this kind of digital dentistry between small and large dental labs? What do you think the differences in adoption in different kind of practices, basically?
I think for large dental labs, they have to invest in some equipments. They are more reliable. So they are not going to buy a desktop 3D printer, for example, because sometimes they are not as reliable as a big printer. They can deliver 100 different pieces. They are more reliable, and there's different kind of materials. So they will have to have a lot of production, and they will need a larger printer and more consistent. They are going to deliver always the same result. So for the small lab here, for example, they are trying to go through this technology, and they use the small printers, the desktop printers, but they choose this because they can buy more than one, 2, or 3 printers. So this is important, because if you one printer broke, well, because of anything, or there's some difference, you are going to have the other one to help you. Even if you are having even more and more work, you are going to produce faster, because when you start offering for your clients 3D printing and you say that it's faster, you cannot ask them to wait because your printer is too busy to deliver the result. So they are always buying one more printer, but they probably choose the smaller because they are cheaper than the others. So for example, nowadays they are printing even in metal, and they are using this for the structure of some prostheses in the industry. And this kind of material is going to be found only in the large lab, because it is expensive, and you have a specific kind of clients for this. So I think these are the most important difference between these.
Well, thank you so much, Mayra. We have a lot more to talk about, but we're kind of running out of time today. There are other things I know you did like many other cases, and we also want to talk a little bit more about Brazil, but we're kind of running out of time today. So I'd love to invite you back, and hopefully with more updates, and hopefully we're out of the pandemic soon for another conversation soon.
Yeah, thank you for all this time here, and it was great to talk with you. And we keep in touch, and we talk again soon.
Thank you, Mayra. And thank you, everybody.
Thank you. Bye-bye.
Bye-bye. That's it for this episode. Be sure to follow us on Facebook, Twitter, and Instagram at 3D Heals, and check out the links in the show notes. See you next time.